My name is Mike. I had a pleasure of speaking with the senior healthcare advisor a couple weeks ago for Senator Clinton's campaign, and I asked her what they thought of the VA healthcare system and what they plan to do to fix what's broken in that system. Right. And the response that I got was, well, we think the VA system is pretty good. And as both a veteran and a reserve officer right now in the Navy, I kind of had to keep my mouth shut to that answer, but I'd like to hear what your reflections are on that.
First of all, thank you for your service. Number one. Here's an example of where I want to give Senator Clinton, or at least her policy advisor, a little bit of credit, because here's what I think that they were referring to. What is true is the VA's vastly improved over the last 25 years. It was a wreck 25 years ago. I mean, it was just completely broken. And you're not old enough to remember that and to have used the system, but it was just a nightmare. And they really have improved it significantly. And one of the things that they've done well is to, once they get people in the VA, because they know that these folks are going to be with the VA system for a long time, they've emphasized prevention more effectively than a lot of private insurers have. And they've emphasized regular checkups and screenings and so forth. They've kept the price of prescription drugs lower because they negotiate with the drug companies for the cheapest available price. So they've actually created, they've been good on information technologies. They've improved. They do a better job, a lot of the private marketplace, in terms of tracking people's medical records and so forth like that. So there's some good things in the VA. The big problems that we have in the VA have to do with, number one, eligibility. I mean, the fact that you've got Priority 8 veterans who were kicked out of the system by George Bush because the notion was they can afford private health care, when in fact this included people who were making $30,000 a year or $35,000 a year, not rich people, who had served their country, were eligible for VA benefits and suddenly weren't. I think that's a big problem, number one. And I'm going to reverse it when I'm President of the United States of America. Number two is just access. Getting in to see a doctor or a specialist just takes way too long. The waiting periods are too long, and in some cases the drive times are too long. Especially when you're living in a rural community, if you've got to go 2, 3, 4 hours to get to the nearest VA hospital, and you're already, let's say, elderly, sick, you may not be able to make that trip in one day, so now you've got to stay in a hotel or a motel. That adds to your expenses. We've got to create more VA clinics all across the state and all across the country that are more easily accessible to people so they can get what they need without being hugely burdened. We've got to work on, VA medical staff, doctors and nurses. They're underpaid. And so that creates problems in terms of turnover, and oftentimes we don't have all the specialists that are needed. That, I think, is going to be a top priority. So what I'm committed to is making sure that the VA is the best medical care possible. Because my attitude is, if people have served in our armed forces, they deserve the best. They deserve the best on health care. They deserve the best on, something else that they deserve the best on is GI benefits. The GI Bill, my grandfather served in Patton's Army in World War II. When he came home from Europe, the GI Bill was able to purchase him his entire college education. And he had money to live with his wife and his child while he was going to school. The GI Bill today, if you come back, depending on how long you've served, even if you served for a long time, you're not able to pay even a single year's tuition on this thing. Well, so that's why myself, Jim Webb, a number of people have come together. Jim Webb's the sponsor of this, a new GI Bill for the 21st century, which drastically increases education benefits for our veterans so that they are able to get a world-class, first-class education when they come home and get a job that will support a family.